From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
It's 26 minutes now before 11 o'clock as the health care debate continues to heat up on Capitol Hill. Congressman Paul Ryan sat down with some medical bloggers from across the country to discuss health care reform and its effect on practicing clinicians. Val Jones is the CEO of Better Health. She joins us live this morning here in the studio with more on Friday's panel and what they got out of it. Always a pleasure. Thanks for joining us again.
Good morning, Dave. This
was an opportunity for a member of Congress to sit down and sort of hear, I guess, you know, directly from these healthcare bloggers. They were physicians and nurses, I guess, so that you get sort of both sides of that divide as well. Was there consensus out of this?
Well, the consensus was that we need to put patients first. And a lot of the debate that we have going on now is about costs and cost shifting and making really rapid decisions without reading the bill. Poor Congressman Ryan came in for our keynote, and he'd been up till 2 in the morning the night before working on some amendments. And, you know, he told us that most of the congressmen and women hadn't had the chance to even fully read some of these bills that they're trying to push forward. So that really concerns us.
Putting patients first, it sounds... It's a very nice phrase, but there are a lot of patients right now who think the current system doesn't do much to put patients first. That doctors are limited by what they can do by healthcare companies, and wonder if this was such a good, if the existing system was such a good one, why aren't all those people out there who ought to be covered by health insurance? I think there's a feeling that something needs to be done, but no real consensus on what that something is.
Sure, it is really tricky, and there are a lot of things that can and need to be done. Our system is not perfect, but in my opinion, it could be a lot worse. And I think that
how could it be worse?
It could be worse if we have a government-run healthcare system where we apply a one-size-fit-all strategy to our patients. I experienced some of the difficulties with government-run programs when I was a rehab physician at a rehab hospital, and Medicare decided to create a rule that basically forced me to deny care to patients because of their diagnosis code. And I just feel that there will be a lot more of that coming down the pike if we choose to spend our money on a huge, expensive bureaucracy that's going to force us as physicians and nurses to do, you know, treat people like codes rather than individuals.
So what should we be doing if DRGs aren't the right way to go, as they're known in the trade? What should we do?
Well, there are a lot of good things that we can do. Obviously, this question is complicated. It's like asking me, how do you fix the obesity epidemic? You have 30 seconds. Yeah. There are a number of ideas that are out there. For example, the CEO of Safeway, Steve Bird, is doing some very innovative programs encouraging his employees to make better lifestyle choices. They actually get reduced costs on their premiums if they stop smoking, if they reduce their cholesterol, if they get fit. Those kind of things are really helping at a grassroots level to get people healthier. And
no question that over a long period of time, that will reduce healthcare costs. This is an instant gratification society. Right. For well or ill, that's kind of how we are. And there are a lot of people who say, we need to do something right now. What do you say to them?
That absolutely there are a lot of things that we can do, but what we shouldn't do right now is rush something through that no one's read. I mean, healthcare is far too important for that. People's lives are at stake. We really have to put some careful thought into what it is that we're doing rather than allocating billions of dollars to new committees that have no agenda. That, you know, well, you know, in the future we'll figure out what we're going to do with this money.
Advisory panels.
Advisory panels, no committees, and commissions without missions. I mean, this is what is in the bill. I looked at it. I was amazed.
It is. It's the Gordian knot for a lot of people. I think the puzzle without a solution, and yet it does seem that we're the impetus right now is towards some sort of resolution, right or wrong. I actually heard a member of Congress earlier today say, we'll pass a bill and then sort of work it out in committee, which didn't exactly seem to be the correct way to do things either. So it's a very difficult situation. Right. For more information, where should people go?
People should go to my website, getbetterhealth.com. Thanks so much.
Val, we appreciate it. Thank you, Doctor.